This last video, I'm just going to go over the medications that can be used for men. The first segment is androgen replacement therapy. So if a man has, really this treatment is indicated for people who have, this is really indicated for people that have hypogonadism or a decrease in production of testosterone. There are a lot of people that advocate its use just to increase sexual ability, virility, or mood, but that's really not what it should be used for, because it does have its own dangers. So you'll see on that slide that it comes in many forms. It could be an injection, PO, topical, etc. Like I said, it's used for delayed puberty or hypogonadism in men. The side effects would be, obviously, if you were a woman taking testosterone replacement, you would develop secondary sex characteristics that were similar to a man. If you had a prostate cancer that you didn't know about and were taking testosterone, you could potentially make that cancer larger. Can lead to weight gain. If you have not finished growing, it will close your growth plates, so it could limit your growth. It can cause gynecomastia, which is breast development in men, and the biggest issue is liver toxicity. So that would be a reason not to just take testosterone for other reasons, but actually because you're trying to treat a deficiency. So if the person is going to be on testosterone medication, they need to undergo regular prostate screening. If we're treating delayed puberty, then we have to be sure we're checking the growth plates, and then report any symptoms that might be significant for liver toxicity. The last group of medications here that affect men are medications for erectile dysfunction. Typically, there could be a psychological component to erectile dysfunction, but typically it is related to cardiovascular disease. So to achieve an erection, there has to be venous dilation into the penis, and that engorgement of blood is what causes the erection. So if you have cardiovascular disease, you could have decreased blood flow to all areas, just like we talked about end organ damage to kidneys or to the eyes or the brain. You can have decreased blood flow to other organs as well. And so in order to treat that, you can give medications that are venodilators that will increase blood flow into the penis. And that is the way that erectile dysfunction medications work. So these are called phosphodiesterase inhibitors, and the main one is sildenafil, which is Viagra. So it's trying to increase the release of nitric oxide in the area of the veins near the corpus cavernosum, which is the spongy tissue of the penis, to allow for engorgement. So it causes vasodilation and increased blood flow. But you'll remember that one of the medications that we talked about that was a selective venous dilator was nitroglycerin. And people that use nitroglycerin are trying to dilate their veins in order to decrease return of blood to the heart, to decrease the work of the heart. Those were the people with angina. So the problem is that you always have to talk to people about who are using Viagra, is that they cannot use nitroglycerin at the same time, because they will drop their blood pressure very low. So that is something to bring up, because sexual activity can cause angina or MI. So if someone who has cardiovascular disease, which is the reason they have erectile dysfunction to begin with, takes Viagra and has sex, which increases stress on the heart, could lead to angina symptoms. They cannot take sublingual nitroglycerin because they'll drop their blood pressure and they could potentially die. So that is a very important part of your teaching for that. The other side effects are headache, flushing. There it says MI, because that's what we're worried about with sexual activity. Priapism is a sustained erection for over 4 hours, and the issue is since the congestion is sort of stretching the tissue that it could cause tissue necrosis. So it usually is more common with people who use the medication that don't really need it, but they want to use it so that they can have a longer sustained erection. But it is possible and very difficult. Obviously, you don't want penile necrosis, but it's difficult to treat because you have to drain the penis of blood then. And I did see that once, and it was horrifying.